The overall goals of treatment are to bring a patient into remission, and how we generally define that is that they're feeling well before their diagnosis. So if someone's having abdominal pain and diarrhea, we look to improve that. There are many different treatment options. We often talk about medications and surgery to treat Crohn's disease and ulcerative colitis, but I also focus on other issues as well, lifestyle issues like the diet, sleeping, smoking. There are a lot of different aspects of the care of one's inflammatory bowel disease that are important. Basically, the medicines that I give my patients depend on where the source of inflammation is and the severity of their disease process. And so there are general classes of medications out there that we often give to our patients with Crohn's and ulcerative colitis. They can include steroids, antibiotics. There's a class called aminosalicylates, which include the medications Asacol, Lialda, Apriso, sulfasalazine. There's a group of what are called immunomodulators, which includes 6-mercaptopurine, azathioprine, methotrexate. There are newer medications called biologic agents. That's infliximab, adalimumab, and certolizumab. So there's a lot of different ways a patient with an IBD can be treated, and oftentimes this requires a lot of communication about what their disease process is, how severe it is, and where their inflammation is located. Surgery is also an aspect in the care of patients with ulcerative colitis and Crohn's disease. Sometimes people need to have part of their intestine removed or their colon removed as part of their disease process. But much like the medications, the surgeries for ulcerative colitis and Crohn's disease have also advanced as well.
I think I tried everything. Unfortunately, for me, it was a huge trial and error. Some things worked for an extended period of time, and then they stopped working. Eventually, I found the right doctor and started getting things a little bit more under control.
Since getting sick, I've had a couple different treatments. Once I did see my doctor and they addressed the fact that I did have Crohn's disease, I started taking a biologic self-injection. And so I was on that for about 8 or 9 months. And unfortunately, I was actually allergic to it. I actually had to switch that medication and start taking another self-injection that I've been on now for about 2.5 years.
There are some risks associated with some of the medications. We spend a lot of time in my office talking about these potential risks. I try to stress that uncontrolled inflammation is much more risky than any of the medications that we have, but I also stress that a lot of the risks and the side effects are reversible. And so it's really important when I talk to my patients that they tell me immediately when they're having side effects or potential side effects to some of their medications.
When I first got diagnosed, I was working with my doctor to get a treatment plan. I trust him and I know he wants what's best for me. So whenever I go and see him, he always asks me, how you feeling? How's the medication doing? And we always discuss that, and we discuss, if we think it's time to go on to a new one, if we need to up the dosage or anything like that. We're always evaluating the situation at hand.
Don't be afraid to ask about something that maybe you read or you researched or something someone told you about. They'll let you know if it's important for you, if it works for you, if it is harmful for you. They're going to be the best person to ask. So I think that you and your doctor are a team, and you guys are going to create the plan together.